Thank you so much, Chairwoman Eshoo, for yielding, and thank you to the witnesses for your resilience here during this testimony today. The ACA, in my mind, led to historic coverage gains and put in place important and meaningful consumer protections. Over 100,000 Minnesotans enrolled in health coverage through the ACA marketplaces in 2020, and 59,000 Minnesotans received tax subsidies to make their health care more affordable. Those Minnesotans include hardworking small business owners like Ali Hatoum, owner of Morning Glory Bakery in Rosemount. The ACA enabled Ali to secure affordable coverage for himself and his family and to put the resulting savings back into his business. Today, we are building on that work to further lower healthcare costs and expand coverage for my constituents and all Americans. So I want to start with Ms. Keith here this afternoon. The ACA, as you mentioned in your testimony, established a temporary reinsurance program. Can you talk a little bit more about how that program helps to reduce premiums and the benefits of such a program in our states?
Yes, thank you for that question. So the temporary reinsurance program for the ACA was in place from 2014 to 2016. And while it varied year by year, that program was responsible for reducing premiums anywhere from 4 to 14%. I would also add that we've seen 15 states use Section 1332 waivers that have been discussed today to do their own state-based reinsurance programs. And as of 2020, the 12 states that had those programs in place had reduced premiums by about 18%. So these programs do allow for significant premium savings.
Thank you so much. I know that reinsurance helps to pay for the cost of those most high-risk patients in the pool, those with serious medical conditions, thereby reducing the premiums for all individuals. But can you talk just a little bit more about how reinsurance works? This is something that I want to make sure my colleagues on the committee understand, as well as my constituents. And then maybe just more broadly, what other measures would be effective in lowering premiums and out-of-pocket costs?
Certainly. So reinsurance can be designed in a number of ways, but at its core, it's about providing funding to help offset high claims, as you've mentioned. This is really a way of giving insurance companies stability so that they're not all raising premiums and pricing, expecting to get the people with the highest, most costly pre-existing conditions. Once insurance companies know that they will have some of those claims offset, they can drop premiums for everyone. So they're not all pricing like they're going to get someone who's really, really sick. It just provides that market stability that insurance companies are looking for. And I will say, we use reinsurance in other federal programs as well. Medicare Part D, for instance, it's a non-controversial program in our other federal coverage programs.
Yeah, thank you for adding that. I often say that flood insurance, crop insurance, other types of insurance also have reinsurance as part of those policies, and often can't understand how they get involved in sort of political debate, since that's just a normal, non-controversial part of an insurance plan. Can you also just talk a little bit more, perhaps, about some of the other measures that you think would lower premiums for folks in the individual marketplace in particular, and what else we could be doing to lower out-of-pocket costs for our constituents?
Certainly. So this is an area where I'm very excited about state experimentation. We've heard a lot about state labs of innovation, and I think providing states with additional federal funding to lower healthcare costs, to lower patient out-of-pocket costs, to experiment in ways and advance health equity, I think is the direction we should be going in. We've seen a number of states, California, Massachusetts, Vermont, New Jersey, I'm probably missing some, who've actually decided to sort of directly help subsidize patient costs and build upon those programs. I think there's a whole range of options, and it would be great to really unleash states and see what they could do, building off of the Affordable Care Act as a framework.
Thank you so much, Ms. Keith. It won't surprise you to learn that the reinsurance proposal is my bill that I'm carrying here in the U.S. House of Representatives. And again, I see this as super common sense, straightforward policy that will help us bring down cost and reduce risk. So I encourage my colleagues on both sides of the aisle to co-sponsor the bill and to support reinsurance. Thank you so much. And Madam Chair, I yield back.